Hey, Dr. Matt here. Just got done seeing a patient with an acute back sprain. Started a few weeks ago, brought on by a lifting injury, and taking a medical history. Looks like it started off doing a lot of back squatting over several months in a row, and was finally catalyzed into an acute episode of low back pain by just bending over and lifting something at the house. So I'm going to shoot a follow up to this and just talk a little bit about one of the things that we see a lot with injuries to the ligament structures on the back of the spine. So a lot of acute cases of low back pain are actually what we call posterior element sprains, and it's due to repetitive bending and flexion that overstretches the ligaments in the spine. Now, this can happen in a one-time acute lifting injury, but typically it happens as a process over the course of months and years. So think things like repetitive bending forward in yoga, bending over to tie your shoes, crunches, sit-ups. We're really against crunches and sit-ups in our patients because it just overloads the lower back ligaments and the discs, and really provides zero functional strength to the lower back. So stay tuned. We're going to get into a little bit of the visible body to see exactly what I'm talking about with these ligament structures through the lower back and pelvis, and more importantly, all the sensory nerves that exit in and around those soft tissues, including the muscles of the glutes and hips. Okay, so here we are looking at the pelvis. You can see I've highlighted the ligaments that we're talking about here in blue. These ligaments are very thick and they run up and down the spine on either side of the pelvis, and they provide an anchor point for the hamstring muscles coming up into here. All that fascia is connected in, and they provide passive structural stability to the pelvic joints. We take a look here, we can see how up the chain, the muscle and fascia, especially in the hamstring area, I'm going to add the nerve structures in, is all continuous into these areas here. And so what I want to emphasize here is all these nerve structures in here have to come out and pierce through those ligaments in the pelvis and into the muscles of the hip here. Obviously, the thoracolumbar fascia is most often involved in a posterior element sprain. So repetitive bending forward and even just a one-time lifting injury. Like I said, most of these posterior element sprains happen over time, weakening the tissue. And then we have a one-time catalyst of a strenuous lift that pushes the tissues past threshold, and we have ensuing injury and acute low back pain. So this is a very common thing that we see, and fortunately, active release is very effective for treating these tissues and getting the scar tissue to realign. And we implement that with proper stretching and mobility exercises to allow the tissues to heal. Most sprain injuries last anywhere from 4 to 12 weeks, depending on how severe they are. And we partner that with offloading the spine, decreasing certain things in the gym to allow the tissues to heal. And there you have it.